our country, India, faces a significant constant challenge in the form of HIV AIDS. And India has a very high number of people living with HIV. And even though the national HIV PR, the prevalence rate, is low, there are approximately 25.44 lakh people living with HIV AIDS in India. And just last, as per the official count in the of 2023, we have 68,450 new cases. So, yes, and there are certain states that have shown a rising trend, including some of the states here in our northeast India, such as Arunachal Pradesh, Meghalaya. Fortunately, for our state, we have been to some extent able to stabilize the epidemic, and as such, for the last 4 or 5 years, there have been no increasing spike in the graph. And presently, however, we still stand at the, as per our prevalence rate, Nagaland stand at number 2, only next to Mizoram. And presently, we have a prevalence rate of 1.34. So, in order to enhance the knowledge levels of awareness to our general public, this intensified campaign is going to be held, and this is going to be following the launching program. This is going to be a 2-month exercise. So this is intended to reach all nooks and corners of our state. And the key objective of this entire 60 days program is to, and as I said, is to enhance the knowledge and understanding for the general public. Number 2 is to promote safe practices and reduce stigma. So, as you are aware, the major step that we can take towards creating awareness to our public is through this kind of awareness activities, and as is obvious, this can be achieved mainly through our media. So under IEC, a lot of activities have been planned, and in detail, our concerned program officers will dwell upon the details, the activities. However, there will be broad-based two types of category based on which all these activities will be carried out. One will be rural activities and one will be urban activities. Under the rural level, we will have village level meetings and HIV awareness. Then we shall be having school outreach programs in all villages as in we have shortlisted 780 villages. Then we will be disseminating information on HIV, STI through our IEC materials. We shall be having interpersonal communication sessions with village health, sanitation, nutrition days. In the category of the urban level activities, we shall be having, it shall be launched through a rally. Then we will be having flash mobs and awareness sessions in all colleges, especially the through our RRC, the Red Ribbon Club agencies. We shall also be having special camps at government hospitals and also sensitization programs for our ombudsman and complaints officers.
Yeah, sir, we are going to cover 780 villages. So, because 780 is a huge number to be covered under the 2 months period of within the 2 months period, but we are hopeful that our dedicated staff field functionaries at the district can do it. And this is we have selected 780 villages accordingly because we wanted to have maximum reach, and in Nagaland we have total villages of 1,280 as per the census. So we are taking 60% of the entire village. So we want to cover almost all the villages, but within 2 months, like it's impossible also to cover all the districts. But we are taking maximum reach, at least 60% we want to reach out, and those villages are the villages where they are they have less access services to HIV facilities, HIV facilities at the district. So we are selecting those villages on need base, and this is being done. The micro planning is being done by our Disha team at the district. So they are selecting the villages according to the need and prevalence of HIV.
So the 780 plus villages will be covering all the districts?
Yes.
So when you see zone-wise,
yes,
that is covering the urban or
no, the zone-wise is for the youth convention.
Okay.
Yeah, it's different. The zonal is for the youth convention, but the villages is district-wise. Yeah, so 780 villages. We have the breakup here. If you want to know, Dimapur. So Dimapur covering Newland and Chumukadima. We have 129 villages to be covered. Kifuri, we have 63 villages to be covered. Kohima, including Simenu, we have 68 villages. Longlang, 28 villages. Mokokchung, 52. Mon, 73. Peren is 52. Pek is 59. Gyonsang, including Shamator, is 46. Woka is 80. Zunhebuto is 102. Noklak is 28. So total is coming to 780 villages. So this is the challenge that we have taken, and I hope and we are sure that our field staff, our field functionary will do well and reach out to and try to cover all the target that we have set.
No, I would say I would look at it another way, in a sense. See, this is based on the prevalence rate, not the absolute number. If we consider the absolute number, like for example, say a state like Maharashtra, it has more than 3 lakh people living with HIV AIDS. Whereas in Nagaland, we have precisely 14,113. That's the latest tally. People living with HIV AIDS, in a sense, people who are also under medication. So the reason we have been able to a large extent, stabilize this epidemic is because of the consistent efforts of our state machinery, specifically under the organization of Nsacs. In that context, at the beginning, I was just enlightening you, in a sense, sharing with you regarding the increasing trend of some states in the mainland also, and then in the northeast also. But fortunately, our state has been able to keep it at a stabilized status.
Give a little highlight of the program that will be associated with the launching of Intensified Iec campaign on the 12th at NBCC Convention Hall. So on the day, we are expecting around 2,500 students and delegates. So this, we are going to have different kind of activities on the day, like exhibition stalls, and photo booth, selfie point, HIV and syphilis counseling and testing, interaction with HIV drug users community, autograph signing and selfie with the Red Warriors, our influencers. And we also have games and competitions which will be done through the SDG and the Birds and the Bees talk. And we also have social media kiosks, pledge signing, and we have exciting gifts for the students who will come and, people who are following our social media pages and social media platforms, they will be awarded, they will be rewarded with gift hampers. And we also have face painting, so all these activities will be done on the day, on the 12th of August. So we want to encourage the students to come prepared and be excited for that day.
For your information, our usual normal activities under the program will go on as usual in this 60 days. But as the name implies, this is going to be an period of intensified IEC campaign mode. So all these activities will be under that theme. And once again, to remind, request, and also to take this opportunity to acknowledge the partnership and the contribution received from your fraternity down the so many years. We take this privilege to thank you, and knowing that the most effective way to carry out this awareness, and as we all know, there are so many activities, ongoing activities, especially to do with awareness. And the key to creating a stabilized HIV status in our state is only through awareness of the general public. And this can be effectively done, especially through your fraternity. Therefore, I solicit and request your full cooperation in the days to come also.
Nagaland TV, Sob Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.